Hello everyone, my name is Thiago. Welcome to our YouTube channel Information Road. In this new series of videos, we're going to talk about the healthcare system. And in today's video, we're going to talk about the factors and strategies that impacted the healthcare job market in 2025. So watch until the end and stay tuned.
Hi everyone, my name is Irina and I have very exciting news. Since we work at the biopharmaceutical company Novo Nordisk, we have a great opportunity to refer you to available position at the company. So please visit our official website Information Road for more detailed information about this opportunity. Please check it out our official media channels such as LinkedIn and Facebook, where we post available positions from Novo Nordisk. But please be aware that we do not speak on behalf of Novo Nordisk and we are not HR partners. Stay tuned and watch until the end. And I'm going to talk about the factors that impact the health job market from 2025 and further. So what I have found, Tiago, is based on the article by Jake Jorgen. It's a forecasted a shortage of between 38,000 and the 134,000 primary and specialty care physicians by 2034 in the United States. According to the Deloitte report, the healthcare organizations estimate a shortfall of 10 million healthcare workers by 2030 around the world. So why is it happening? What are the reasons for such a tremendous shortfall of physicians and healthcare professionals? So the reason are, or the factors are, is low pay, burnout, prolonged hours of stressful and demanding conditions, and reduced job satisfaction. Moreover, another factor is actually the population of old people is increasing, and for example, it is projected that the people of over 65 years old will be increased by 13.4 million within 10 years forecast in the United States. And furthermore, integration of a technology tools such as the AI, telemedicines, and the other digital tools in the healthcare in the developed countries call for more skilled workforce. Recognize some of these factors. For example, in my home country, Kazakhstan, such as low pay, burnout, stressful and demanding conditions, very demanding patients, and of course that all lead to the fact that also have a shortage of healthcare professionals in Kazakhstan, especially in the rural areas. In rural areas, actually, there is no healthcare professionals, so local people need to travel big distances to more bigger villages where they can find a hospital with healthcare professionals. And moreover, I would like also say from my own experience is actually that when I studied at the medical university in Kazakhstan, I saw that half of the students who studied the medical education at the medical school stopped. So they basically didn't study until the end. And those who managed to study the medical education until the end, it's not guaranteed that they have actually worked to be the healthcare professionals during their life. So what about Brazil? So what do you think from your point of view? Do you have such a problem in Brazil? And what could be the possible factors from your point of view?
I can remember Brazil also suffers by this shortage of healthcare workers in recent years, or I can say that there specifically most of the doctors are moving from their educated in the private universities, which is the cost is very high, like for example in the US. And then once they start their practice, with very short period, they gain enough have gained enough experience in the public sector, so they open their own business and they carry on with their careers. But it's still not enough, even for the nurses and all these healthcare employees. They also lack the payments and the difficult conditions they have to deal and to live with day to day in the daily basis is kind of difficult for them. So we also in Brazil suffer by the shortage of employees in healthcare. It's something that needs to be taken into account in the southern hemisphere, I would say.
Yes, and actually, I also would like to add from my also opinion and what I have also observed, not only in Kazakhstan but just also like trend in around the world, that when you work for the governmental hospitals, for governmental institutions, of course, like you have a big line of patients because it's free of charge, and then of course, you can face with a burnout, with a low pay, quite soon than those who work in the private sector. And actually in Kazakhstan there is also a trend that if you are very intelligent, experienced, and know your area in the healthcare system, no matter if you are a doctor or like surgeonist or another type of doctor, then they will also try to switch to the private clinic, private hospitals, because of course first of all the salary is much higher, and plus you don't have so many patients serving every single day in comparison to the governmental hospitals.
If you like this video, smash the like button and leave your feedback in the comment section below. Your feedback is very important to us. And now I'm going to talk about how the digital transformation has gained steam in 2025. Digital transformation was listed as the issue most likely to impact the global health system in 2025. And why do you think it is like that, Zarina?
And why?
Because the healthcare system started adopting these digital technologies later than comparison to the fields such as retail or manufacturing industry, for instance. And now I'm going to talk about the survey conducted with the chief executives from the United States that responded 60% highlighted the need for electronic medical records or MRRs, and about 9% of the survey expect to reinforce the usage of these digital transformation tools and services in 2025. And now I'm going to talk about strategies for maximizing digital technologies in the health systems. To achieve the benefits of these digital technologies, health systems should consider implementing the following strategies.
Which strategies, Tiago, can you explain it, please?
Yes, to migrate to a cloud system. Most have not transitioned yet to a cloud system which can provide them power and computing, protecting guys against cyber attacks and data storage, bigger data storage, and reinforce cybersecurity measures, which means while implementing digital transformations, it can also lead against problems with cybersecurity. So they also need to increase their focus on this.
That's all for now. Please subscribe to our YouTube channel and give us a thumbs up. Follow us on the social media channels and visit our Information Road website. See you on our next video. Bye bye.